Welcome back, everybody, to another week of Excuse Me, Doctor. I'm Dr. Melissa Clarke, your host. Please call me Dr. Mel. I am happy as always to be right back here with you this week doing what we do at Excuse Me, Doctor, making sure that you have all the information that you need to make wise health decisions for yourself, your family, and even your community. We're streaming on YouTube and Facebook. For all the newbies that are joining us tonight, please hit that like button if you're joining us on Facebook. And if you're on YouTube, you know what to do. Hit that red subscribe button. I really appreciate you for it. And remember, we are here to make sure that you get your questions answered. So please put them in the chat as we go through the show. You know, we're going to get to you first come, first serve. So please start putting your questions in the chat as we go through the show. And now let's get ready to create an amazing week for ourselves with all the health topics and subjects we are going to cover tonight. And to do that, you all will be delighted to know that I am welcoming back Miss Lila Mays and Mr. Wayne Bruce.
Hello,
Wow.
hello.
Wow. I'm about to tear up. Lala's
Why is that
back.
way? Why are you about to?
Lala's back.
I'm sorry, I had some stuff to do. Sorry.
Lala's
I
Well,
missed
we are
back.
y'all.
glad. We are glad you are back because you
She
know
was
both
hanging out
y'all
with Silk Sonic. Not Silk Sonic. Six Sonic
Six Sonic at the Grammys.
at the
But
Grammys. She was
we are
Six
glad that you
Sonic.
are both back, bringing us the word from the street and letting us know what's on everybody's mind. So welcome back.
Yeah. Hey,
Glad to be back, Dr. Bill.
indeed.
I'm here for it. I'm here for Lila's. I'm excited about this week. It's something that, has been going on in the news for quite some time that
Yeah.
we've been reading about. So, I mean,
Yeah. We're going to talk about, I think you're talking about what the show is about tonight, which is long COVID.
Right.
And yeah, we know that there's a perceived risk or perception, let's put it that way, that the pandemic is over.
Right.
But even though cases are going down, there are people who've had COVID that are living and a lot of silent suffering going on
Mhm.
with a lot of different symptoms that they can't explain. And because COVID disproportionately affects people of color, there's a concern that long COVID is affecting more people of color. So we're going to be going through all of that tonight. We have two fantastic guests. And so I really encourage anybody who has any curiosity about this subject um, to share this. If you're concerned about whether long COVID is something you have, what you can do about it, please tune in, share it with those you know that might have this as a concern, because we are going to break it down tonight.
All right.
all right, well, let's get to it.
Let's
Let's
go.
start in where we start in at the beginning with the recap.
All right.
Yeah.
Well, you know, when I do the numbers, we always start off with the numbers. I'm starting off with vaccinations tonight, okay?
Okay.
Because 70%, we've reached that threshold of 70% of people over 5 years old are fully vaccinated. That means they've had 2 doses of an mRNA vaccine. Only 47%, though, of people who are eligible for a booster, so that's everybody over 12,
Mhm.
have had a booster. So that's concerning, right?
Mhm.
Because even though new hospitalizations are at their lowest, thank God deaths are down, cases are about to go back on the upswing. We've seen that in certain states. Actually, Philadelphia today announced that it's bringing back a mask mandate for indoor spaces because their case count is 50% higher than it was 10 days ago. And
Oh,
then,
wow.
yeah, and then y'all heard about Broadway, what's happened on Broadway and in DC, right?
No, I haven't.
No.
Well, there was the Gridiron Dinner, which is this gathering of Democrats, which seems like it was a super spreader event. And
Oh.
so the DC mayor has it, has COVID now. Many high ranking Democrats have COVID. And then on Broadway, Broadway shows have had to close down because of cast members getting COVID. All this in the past week. So it really does seem that, this BA2 variant is starting to pick up a little bit. And we're not necessarily going to see it in the numbers because there's so many people doing home tests, right? So
Mhm.
we kind of just have to go by what's happening with the wastewater, as we've talked about. And we're at this point of a perfect storm where people that got boosted in the fall have waning vaccine immunity, or vaccinated in the
Mhm.
fall have waning vaccine immunity. We're dropping the vaccine and mask mandates for a lot of activities, and we're in the presence of a highly contagious variant. So
Wow.
it's the makings of a perfect storm. We just have to cross our fingers that the immunity that we got with Omicron and that the vaccination rate of 70% is going to help us out.
Ooh, child.
It's a
I
lot.
was in Las It's a lot. I was in Vegas last weekend, and, you know, there's
For the
lots of
Grammys.
people for the
Uh-huh.
Grammys, but there were lots of people unmasked, lots of people in spaces. I was walking around with my mask on, but I declare I came home and took a rapid test, and then the next day a PCR. I was like,
Right.
I just need to see what it
Right.
is.
Yeah.
Whew.
Exactly. And remember, you might have to test 5 days after,
Yeah,
because it
yeah,
really takes about 3 to 5 days to kind of percolate before your
right,
test will
right.
turn positive. So you may have to retest just to
I
be on the
will have
safe
to
side.
retest. Yeah, yeah,
Yeah.
yeah. I took a test when I got home. I took a test Monday. I took the PCR Wednesday. So yeah, it's time for me to take another test. I'm sure.
Yeah.
Yeah, I
Um,
got a few days before I take it. I was at a event this weekend. First
Yeah,
event
you
in two
performed, right?
years. First event
Wow.
in 2 years. First jazz festival that I've been immersed in 2 years, and
wow. Yeah.
could have been a super spreader event. It was
Yeah.
very
I mean,
scary.
Well, we'll be testing even though we kept our masks on. But we'll be
yeah.
testing tomorrow.
Yes, we'll be
Yep.
testing.
um, well, so we got through the numbers,
Yep.
right?
Yep.
And speaking of testing and all of that, there's a little variant out there.
Yeah.
Uh,
So in addition to the BA2 variant, now
right.
the UK has found this XE variant. That's a new name in about 650 people. It's really sort of the love child of the BA1 strain and the BA2 strain of Omicron.
Oh wow.
And it just reminds us that variants happen. They can happen anytime, any place, with anybody. Um, it's when the virus mass produces new virus particles, mistakes happen in that mass production, and a variant can occur. And so, the fewer people that are unvaccinated, the more infections that are happening, the higher the risk of a variant emerging. And the UK is just coming off of a BA2 surge. So this isn't surprising. We don't know yet whether this is more transmissible or more severe, but again,
Okay.
just something to keep an eye on.
Yeah, I was that you answered my question before I could ask it, Dr. Mill, like in terms of how contagious it was and all of that. But I just feel like whenever we hear about these variants, especially in the UK, we just have to know it's on the way.
Right. That's the conclusion. Like 2 or 3 weeks
Right?
later, whatever's happening there tends to happen here. You're absolutely right.
Yeah.
Yep.
Number three, I find interesting, not like surprising, but quite interesting, in that whites are less concerned about COVID because of racial disparities.
Concerning. Yes. I was surprised. I mean, I won't say I was surprised, but someone actually did a study on this. The University of Georgia.
Mhm.
They looked at data from late 2020. They actually talked to people in late 2020 and showed that American whites thought that racial disparities, when they realized that basically it was more black and brown people getting
Right.
COVID, they felt that it applied to them less. And so they had less personal concern about it. There was less empathy for those people getting sick. And together, that reduced empathy and less concern predicted less support for safety precautions. right? Wearing masks, wanting to reopen the economy, because we actually, saw that happen once that
Right.
those initial numbers came out about who was getting disproportionately affected. And
Right.
that's ironic because really the majority of people that have died from COVID have been white because the majority of people in this country are white. And as vaccination rates have um, almost equalized, right? We're seeing actually that um, in red states that white people actually are dying more than Hispanic people, and only a little bit less than Black people.
Wow.
So it's concerning. Um, you know, it's concerning, not necessarily surprising, but I think it's important that, the authors of this paper said maybe we shouldn't publicize that there are racial disparities so
Mm.
that everybody can get on board. I don't know if that's a good solution. I'm just curious. I'd love for people to put in the chat what they think because I found this, really interesting.
Yeah,
It's concerning and interesting,
indeed.
Yeah.
but you know
It
what
it
else
really
is interesting?
what's that?
That the number four, you talk about fracking tonight. You have up there fracking. And fracking, from my little bit of knowledge, I am not a doctor or a
You don't
geologist, but
uh-huh.
fracking I wouldn't associate as a health uh concern.
This was news to me too, because fracking involves pumping large volumes of water, sand, and chemicals into subterranean rock to release natural gas. So if you're pumping chemicals with water, it's going to get into the water supply, right?
Um,
And so it's been linked to higher mortality for elderly people that live near fracking sites, issues like heart attacks and reduced fertility, and a new Canadian study just came out that showed that if you live within 10 kilometers of a fracking site while you're pregnant, it's associated with higher risks of birth defects and babies born small for their age. And right now in the United States, we have 300,000 fracking sites distributed across 12 states. Some of those are Louisiana, California, Texas, Oklahoma, basically, widely distributed. And so I wanted to highlight it if you live near a fracking site, you have some unexplained health challenges, you know, it
Hmm.
might be due to how close you live. And
Hmm.
it's also one more climate issue that we really need to bring to the forefront because the whole reason why we have high demand for natural gas is because of the way that we don't have alternate energy sources that we've invested in. So just want to highlight that as an issue.
wow. Well, that was interesting. Not like I said, not a geologist, but the next thing, I am a man. I am a man. And anytime we talk about the next uh subject, sperm, I am concerned, although I'm not on metformin.
Okay.
So give me the lowdown on that, Dr. Mel.
So there was a study that showed that men who take metformin were 40% more likely to have offspring with birth defects. It was a study in Denmark, and they found that the birth defects were mainly with male offspring and their genital tracts were malformed, right? So,
Oh,
what
okay.
is metformin? Metformin is a common drug that's used to treat diabetes and prediabetes. And it was important that the researchers noted that these birth defects were not seen with other common diabetes medications, including insulin and other categories like sulfonylureas and other kinds of diabetes medications. It's important to note this is just one study, so it needs more research. But given how common metformin use is, um, if you're a man taking metformin and you think you might want to conceive, talk with your doctor about it. Maybe see if there's another medicine that they might be interested in that they think that you might, do okay on managing your diabetes or your prediabetes. And it's also important to highlight that men in general should be aware of how their exposures might affect their sperm. A lot of times, a lot of the attention is on women and what women consume and do with their bodies. But men too, your sperm, you make sperm every day. So whatever your sperm are exposed to, can potentially be affected. So just something to keep in mind.
Wow. And on that note, we got to get out of the recap. It's a little, for me, it was a little.
Was it traumatic, Wayne?
It was a little traumatic when you started talking about that. Anyway, so you know what's next?
Better to be informed. What is next?
Indeed.
It is
the weekly debunk, stopping misinformation in its tracks.
So again, I get a text from Tyrone Twitter Fingers, who was vaccinated now. He said, I got my first 2 shots, so I'm fully vaccinated. I ain't trying to get any more shots. Besides, only old people need the booster.
No, Tyrone. I don't know about that. Excuse me, Dr. Mill. Is that true?
Well, I'm glad that he has had 2 doses, but the reality is that the booster is recommended for people who are vaccinated. And over time, so 5 months or more, it's expected that your immune response is going to weaken. So getting a booster dose has been shown to decrease your risk of COVID-19 infection in the near term, and also improve your chances of not getting severely ill or dying even months later. And so boosters are recommended for anybody who's 12 or older. People who have a moderately or severely weakened immune system, so people with HIV or who are undergoing chemotherapy or organ transplant, should get an additional primary dose plus a booster dose, right? And as I mentioned, it's recommended 5 months after getting 2 doses of Pfizer or Moderna, or 2 months after you got the 1 dose Johnson & Johnson. Pfizer is recommended if you're 12 or older. Moderna and Johnson & Johnson are for those 18 and older. Now, you know that recently a second booster dose was recommended if you've gotten the mRNA vaccines. And that's, again, for people who have a weakened immune system or people who are over 50 who had their first booster more than 4 months ago. So important to kind of keep up with that schedule, but wanted to especially highlight that second booster dose now for people over 50 and people who have a weakened immune system. So that's the deal for Tyrone.
And there you have it.
All right.
All right. Well, thanks for joining me. I'm going to see y'all in a little bit. We are about to go into our main topic for tonight. I want to remind everybody, please go ahead and start putting your questions about the recap or the debunk in the chat and about our next topic, which is long COVID. So for those of you who follow this show, you know about long COVID. I talk about it from time to time. Just last week, we talked about the fact that having had COVID increases a person's chance for developing diabetes, even if you've had a mild case of COVID. We've had now people who've been COVID survivors for over 2 years. And there's a lot more information coming out every day on long COVID. With this last surge of Omicron this past winter, we have 30 million new people who have COVID just in the past few months. So, and of course, total cases in the United States, over 80 million. So we're going to talk about this tonight because there are potentially a lot of people out there who are affected with long COVID. And we have a brilliant panel that's going to talk us through this tonight. So my first guest is Dr. Keith Newby. He's a cardiologist and president and CEO of Fort Norfolk Plaza Medical Associates, and he's the medical director of health equity for Centara Healthcare. He's also president of the James E. Newby Jr. MD Foundation, named after his father, which through education and philanthropy serves communities of color in Hampton Roads, Virginia, where Dr. Newby is from. Welcome, Dr. Newby. Thanks so much for joining us. And can you hear me okay?
Yes, yes. Thank you. I
All
think
right.
I was still on mute for a minute, but thank you for having me. I appreciate it, and it's a joy to be here with you tonight.
Absolutely. And full disclosure, Dr. Newby and I grew up together in the same church in Norfolk, Virginia. So he is my homeboy. Thank you so much for joining.
Thank
So
you.
and then my next guest is Miss Sahtiya Hammell. She's an educational professional who has worked in multiple school districts and universities on diverse issues ranging from diversity, equity, and inclusion to mental health, interpersonal violence. She's currently a health education coordinator at University of Texas at Austin, and she's joining us, though, to talk about the fact that she has had long COVID symptoms for the past several weeks after giving birth to her son. So, welcome, Sahtiya. Thank you so much for joining us. And Sahtiya is my niece.
Thanks for having me, Dr. Mel.
All right. Thanks for being here. I'm going to jump right into this. Dr. Newby, can you break down for people what is long COVID?
Okay. So essentially, most people that develop COVID, those symptoms may last 1 to 2 weeks after the onset. But when a person experiences those lingering symptoms, 4 weeks to 6 months or longer, that is essentially considered long COVID or long hauler syndrome. So although we see, older people and people with underlying medical conditions are most likely to experience some of these symptoms, but we're seeing even younger people, otherwise healthy individuals, who may feel unwell for weeks or months after infection. So that's kind of the definition of long haul or long COVID.
And
And I can't,
are we,
yeah,
oh, go ahead.
I was going to say now, I don't know if you want me to go into what those signs and symptoms are, or you want to wait on that part, but just let me know how you want to proceed.
Yeah, no, go ahead and tell us what some of the symptoms
Okay.
are.
So just to make sure everybody's aware, the most common things that I see is that fatigue, shortness of breath, cough, joint pain, chest discomfort. Some people get this stuff called brain fog or just memory lapses, muscle pain or muscle aches, headaches, palpitations or fast heartbeat, loss of smell or taste, depression, anxiety, fever, dizziness. I mean, there's like this host
Yeah.
of symptoms that you can have, but that's kind of the most common ones we see.
Yeah. I think I read somewhere there was over 190 different discrete symptoms, right, that fall under the umbrella of long COVID. So Tia, I want to go to you for a moment. Um, Maybe you could tell us first, start, how do you think that you got COVID in the first place? And then maybe go into how it evolved into the long COVID symptoms that you're having now.
So I'm pretty sure we moved into a new home, and the movers did not have masks. Just we asked them to put them on. They did not. So we opened all the windows and put on. We had our masks on. Everyone in my family had N95s, but the movers didn't have any. So we were pretty sure that that's how we got COVID. Probably 2 days after the movers were there, I think my husband was the first person to get sort of the cough and some of the symptoms of feeling like he had a cold. And then the next thing I knew, I had a sore throat. So we took a COVID test, a rapid test that was positive. Then we went on to take a PCR test that also showed up as positive. And by, I think, let's see, we took the rapid test was the 5th or 6th, and then the PCR was the 7th. We got information back on the 10th, and I delivered my son early. I was pregnant at the time, in my 3rd trimester. I delivered my son early because I had, racking coughs, just really sore throat, feeling really tired. Thankfully, he was fully healthy. He never tested positive for COVID himself. So we had to be masked the whole first week of his life.
Wow.
We had to stay in the hospital a couple extra days. When we did bring him home, we had to stay masked for the full quarantine period.
Wow.
Yeah.
And then did you ever feel better after that initial infection?
I think so. I think by the time I left the hospital, I didn't really feel like I was anything but a recovering mother. I just felt like,
Yeah.
the exhaustion of delivery.
Sure.
But as the sort of weeks by week 3, by the time we went into that second week checkup and third week checkup, I realized that I was really tired. Like I was just far and above tired. And this is my second child, so I've been a nursing mom before. I also still had this lingering cough that was causing it was just really painful, like throughout my entire system. Like I felt like all my muscles were just like racked with this cough. And then by the 6-week visit, I had fallen out of the tub. I had gotten really dizzy. I had gotten sort of like headache pains and chest pains semi-regularly at this point. It came when I was standing, it came when I was sitting. I could be folding clothes, and I would just have these like shooting pains in my head and my chest. And it hit me once when I was standing in the shower, and I just fell out. So that sort of was the real
I mean,
kicker.
that's just an amazing amount of symptoms, and trying to juggle and experiencing all that while also caring for a newborn, I know must be overwhelming. Um, and then you mentioned so many different symptoms, Dr. Newby. What what are some of the causes of long COVID? How is it that there's so many different symptoms, like how Sahtiya is experiencing now?
Well, that's really the issue because we really aren't fully aware of why people develop it. We've seen that it seems more in those who've had those chronic conditions, but as you can see with your niece, I mean, she's a young, otherwise healthy person. And that's
Mhm.
why I'm so big on the vaccine because even though, people can still get COVID after vaccines, there's no question about that. But when you look at pound for pound, those people that have been vaccinated have less likelihood of developing COVID-19 and the long hauler syndrome. So it's a tough road, because there's a lot of things we're still learning about COVID. But to answer that question in finality, we really aren't fully aware of what causes it. What are these things that about one individual that may create that long COVID versus someone else who may recover quickly. And that's why I tell people don't roll the dice. I mean,
Yeah.
I don't gamble because I lose. I mean, that's why Vegas people, they listen, people in Vegas love to see me coming. They're like a sucker born every day. So I'm like, why take that kind of risk? I tell people all the
Right.
time, be careful out here. The pandemic is truly not over.
Right. And I think, well, Sahtiya, would you mind sharing your vaccination status?
I've had both my vaccinations and I've had my booster.
Okay.
And sort of late October, I had my booster shot as well.
Right.
So as protected as possible. Same with my partner. He has both of his shots and his booster.
Yeah. And I mean, we know that especially with the Omicron surge, that people who were vaccinated still got Omicron because the vaccine, because it had so many mutations that it was able to sort of get around the immune system of those people that were vaccinated. Um, but we do know that long COVID does happen less often. Doesn't mean that it doesn't happen at all, as we're hearing with Sahtiya, but it does happen way less often in people who are vaccinated. Um, so, Dr. Newby, what are you seeing in your cardiology practice uh, with patients with long COVID?
Well, essentially, I get a lot of referrals for people who come in with chest pain and shortness of breath who are post-COVID infection. The majority of people I'm seeing are unvaccinated. I do get some who've been vaccinated, but the vast majority are unvaccinated. So they come in with these symptoms of unclear etiology, and I tell people, I say, well, listen, think about what COVID-19 is. It's an infection from a virus that causes inflammation. And that inflammatory process could either be short or long. So you talk about something that's affecting almost every organ system. That's kind of one of those things that you kind of trying to figure out how do we deal with this because there's no right or wrong answer in terms of treatment strategies for these individuals. You have to treat symptomatically, hope and pray that they get better, and then move from there. We see this clot formation that people develop, because of that inflammatory process, more clots form, which can cause problems. We don't always know that that's the cause with long hauler syndrome or anything, but that inflammatory process is what we see. So I get a lot of referrals for chest pain, shortness of breath, fatigue, just the standard kind of gamut of symptoms post COVID. And it's in trying to sort through how many of these people truly have detectable heart problems and who do not. It's a challenge, and it's going to continue to
Yeah.
be a challenge.
Yes, absolutely. And then I think for the neurologic symptoms, like the fatigue could be also neurologic, but numbness, tingling, headaches. I know neurologists are getting lots of referrals. Have you seen or heard of any particular medications that are helpful at this point in time?
Not particularly. I mean, what I am seeing is people ask about like the vitamin D, the vitamin C, the zinc, and all that. I think the way I kind of tell people is you really want to boost your, well, I shouldn't say boost your immune response, but you want to maximize its potential. I don't really look at those vitamins and things as being a immune booster because you can only push your immune system so far. But I do believe that you can maximize your immune response. So in other words, those people who may have a reduced immune response for whatever reason, either they're not physically fit or what have you, you want to maximize that. So if you have had COVID, if you're trying to prevent it, you want the vaccine, no question about that. But in addition to that, you want to be at your healthiest, keeping the weight down, keeping your vitamin kind of supplements at their highest to try to make sure you prevent that. So medications, not really, not so much so, but I think just the kind of the supplements that we can have, have been shown to be helpful.
Yeah. And then I've also read too that some of the long haul syndrome, especially the ones that have to do with the nervous system, so the weakness, the dizziness, the numbness, the tingling, um, some of it is thought to be due to COVID sort of reactivating viruses that are already in your system that have been dormant, that have been controlled by your immune system. And so when you get COVID, it sort of overwhelms your immune system and allows those other viruses that have been under control to sort of reactivate. So that sort of speaks to what you're saying about maximizing your immune response. And then I've also heard too and read that a lot of people who have long COVID who were unvaccinated who then get vaccinated, that the act of getting vaccinated also improves your or improves their long haul syndrome. It doesn't make it. It may not make it. It doesn't make it worse, and it may make it better. Is that something
Yeah.
that you had heard as well?
Yeah, I've heard that as well. The key thing I think is you want to anything that has potential to improve a situation. To me, I'm say let's do. I mean, I get all the issues you talk about debunking theories. I mean, I've heard about every interesting theory about why people don't want to get vaccinated, especially in our folks. And it
Mhm.
could be a little challenging trying to debunk some of those rumors. And unfortunately, so I'm fighting with Facebook on a regular basis and TikTok. And I said, man, I didn't know I had to fight with TikTok to get my
Yeah.
point across. But we do know that whoever has the mic and who has the loudest voice can sometimes be influencers. So, I really push people to understand that the vaccine is not the enemy. It really is not the enemy. COVID-19 is the enemy. The vaccine is there to try to help.
Right. Now, we've seen, I don't know if you were listening at the beginning, but Lila was mentioning that she went to the Grammys, nobody was masked. Uh, Wayne and I were at a jazz festival this past week. Nobody was masked except me and maybe one or two other people. Um, it seems like people aren't taking the possibility of long COVID into their risk analysis when they decide to go out in public and interact without a mask. Sahtiya, what would you say to those people who are sort of weighing the risks right now of how they're going to change their behavior, given that mask mandates are sort of going away or have gone away?
I mean, there's no way to know how you will respond to COVID. You could be perfectly healthy. I'm right now at 3 months out from delivering my son. At this point in time, after my daughter, I was hiking 4 miles on Ridge Trail, and today, this past week, I tried to walk at the Cherry Blossom Festival, which is maybe 4 or 5 blocks, flat land. There was a lot of sitting in between. There was eating, and I woke up today feeling worse than I did after hiking 4 miles. Like I
Wow.
just completely body tired, um, slept half the day. Like just, it's really intense and it's really debilitating. And especially when it comes to terms of like, if you're working and trying to get, disability or things like that, it's really difficult to get mobility with that because it's so murky and so up in the air. And so there are just so many long-reaching effects on you yourself, on your work life, on your own sense of efficacy. Because it's like, how long will you be out? I don't know. I don't know how long this is going to happen, how long it's going to be a problem for.
Right.
You know, so please get vaccinated, get boosted,
Yeah.
do what you can to avoid it.
Yeah, and I didn't even know all the things that you were going through. So listening to what you're saying is just is heartbreaking to hear everything that you're going through. And I can't even imagine if you didn't have a spouse, for those people who go through this, who have kids, who don't have a spouse to help out, all that might be entailing in their lives. Um, the good thing, I think, is that the Biden administration has put a lot of new funding into helping to address long COVID. So they're ensuring that health insurance coverage for long COVID care is accessible as possible, so that even Medicare and Medicaid will cover treatment for long COVID. So that's good. There's been expanded coverage for pulmonary rehabilitation. So for those people who are experiencing shortness of breath or have had lung damage because they had COVID, getting that rehab is now covered. Um, and also the fact, trying to increase awareness, you mentioned disability, that long COVID might qualify some people, if they've had it long enough, to be covered under the Americans with Disabilities Act. So all those are great things. Dr. Newby, with your health equity hat on, is there anything else you think that needs to be done when it comes to, um, especially communities of color that may be disproportionately affected by long COVID?
Well, I think the key thing is education. I can't emphasize that enough. We need to be louder and more boisterous as it relates to how we convey the importance of vaccines. What happens is you have tight knit communities, tight knit living environment, and relationships where you are close knit in terms of how you live, how you work. Those are the people that are going to be at high risk, and unfortunately, so when you look at the types of jobs we have, where there are a lot of customer service, a lot of people who are in the industry, like you talk about restaurant business or hotel businesses, or
Mhm.
issues where you're in environments that are going to put you at higher risk. Then going home to your family, our job, as I see it in equity, is to figure out how do we level the playing field. One of those
Mm.
ways of doing that is through education, getting people access and dispelling a lot of those rumors and trying to help people see how do we make this a better place for you to live and work and be safe in the environment. And I tell people this all the time. You can't you can't outrun COVID. I get people all the time, my young, healthy people. Listen, I exercise every day. I do all
Yeah.
these different things. And I say, listen, this is the bottom line. I say, if your body hasn't been exposed enough to COVID, I don't care how in shape you are. If your body's not used to seeing that, your immune system has not been exposed to it enough
Yeah.
to fight that infection when it comes in. Almost like if you're trying to fight an army. If you're one person trying to fight an army, if you're just one person, the likelihood of you being
Not
successful
gonna go
is going to be
well.
pretty
Yeah.
small. Yeah. So
Yeah.
that's what I say: education, more education, access, and that's really what I'm pushing down here in Virginia.
Okay. And also too, I think when it comes to long COVID and developing treatments, we need to be included. I know that there's a Facebook out there group out there called Black survivors of COVID, or Black survivors of COVID with long COVID, something like that. And you know, they are approached all the time about participating in research studies. It's important that people of color be represented in these research studies to help find treatments for long COVID, because we want to make sure that the treatments that are found apply to everybody. So I think that's also really important. So we have just enough time to get some questions in. So I want to make sure that I bring back Lila and Wayne to curate our audience questions. Are there any out there waiting in the wings?
Lila.
Yes, of course. I have questions. I always have questions.
All
First
right.
question is from Lila.
Okay. You got mic
Is
privilege.
this right? Is this a new phenomenon, or are there other infections that have caused long-term syndromes? I mean, we're talking about long COVID, but is this a new thing, or has this happened with other infections, illnesses, etc.?
Well, I don't think not to the degree that COVID is, because it's so infectious.
Okay.
Some people can get things like chronic fatigue syndrome from certain types of viral infections. There are, like, even people who've had syphilis and other types of chronic infections, can have long-term effects. But on this level of COVID, when you talk about the number of deaths, the devastation it's caused, I don't think anything short of typhoid fever, has kind of gotten to this level that COVID has brought us to.
Yeah, we've had 80 million cases in the United States alone in the last 2 years.
Yeah.
So just with the numbers, I think it's estimated at minimum that 5%, so 1 in 20 people who got COVID will have long COVID. So at minimum, that's 2 million people. And some estimates say up to 60% of people
Wow.
get long COVID. So that's massive, massive numbers of people. So it's really the numbers, I think, is the issue.
So we have a question from Wayne, and this is
Okay.
to Sahtiya. How has your job and your employer been through this these episodes and you dealing with these symptoms?
My employer has actually been great. My supervisor is really understanding, possibly because we work in the health field, we're health educators, right? So I think they've been really great about being understanding and accepting. That doesn't mean that, the labyrinthine process of getting, the forms checked and turned in to get, like, I don't know that I've gotten any of my short-term disability yet. And I don't know that I've necessarily been fully approved for that yet. And it's, you feel crazy a little bit because you're just talking about all the things, and you talked about how many different types of symptoms there are. The things that I mentioned as what I recognize as long COVID, but going into the doctor, he was like, "Is that a bald spot right here?" And it turns out alopecia is another one of the sort of like listed symptoms for long COVID. And noticed that my nails had ridges. And so, like, things that I didn't even think about, I noticed that were different. I'm not attributing to what's wrong. And so it just feels like an ever-growing list in terms of what's going on. And thankfully my employer is my supervisor is understanding, but the actual, like, medical establishment and the disability piece and the funding piece to help support me being able to stay home and not try to, like, drag myself to a computer through a migraine or chest pains has been the challenge.
And that's really that's a blessing that you do have a understanding employer. And as I mentioned before, the Biden administration, I just wanted to highlight, making sure that long COVID is covered under the Americans with Disabilities Act, I think is huge. And I do have to get in there. I'm glad we don't have to explain what alopecia is. Everybody knows what it is now.
Right.
Yeah, just don't hit me if I don't know.
Right. So
but it's an I will say it's an inflammatory condition, so it's not a surprise that it is one of the constellation of symptoms with long COVID. Yeah.
And who knows that well, this is off subject, but a little bit off brand, that uh, the famous alopecia case that now happening, it started about 18 months ago. So who knows if they had COVID and
Right.
could have
Exactly. That's a
developed
possibility.
alopecia. We have a statement from a Carol Fletcher, and Carol says, "I had COVID in 2020, was vaccinated and boosted last booster in December. Caught COVID again a week ago. I have experienced hair loss and shortness of breath when walking and fatigue. I'm sure I have long COVID symptoms. I am 64 years old."
Well, my
Wow.
comment to that would be, and I'm sorry to hear that that's the case, but just imagine if you hadn't been vaccinated, what might have happened. And that's what I'm trying to make sure people understand, that this such as a high risk disease with so many things that can happen as a result. And I just tell people all the time, I've had in my practice probably 85, 90 people die of COVID in the last 2 years. And that's just in my practice alone. And that's who I know who have died of COVID-19. Every last patient I've had who's died has been unvaccinated. No vaccinated individuals have I had personally who've died of COVID-19. So I'm glad you were able to get that. I hope your symptoms resolve. I really hope and pray they do. But please don't be discouraged at all. Be encouraged that this too shall pass. And I know that you will get better. I feel in my heart. Just give it time, work through the process, but just make sure you keep and stay encouraged.
Right. And the other thing I would just add, thank you, Dr. Newby, that was so beautifully said. I would also add too that if you do have symptoms, you might not want to just automatically assume that it's long COVID. Maybe you've already gone to seek medical attention, but you should definitely, if you're having shortness of breath, if you're having chest pain, any of those other symptoms that you mentioned, definitely go to your primary care doctor and get those things checked out. Um, as Dr. Newby said, in his practice, one of the things he does is he tries to figure out, well, what is long COVID, what is actually physically going on. Is it something that can be remedied? Is it something that's not long COVID? There are other conventional treatments.
Because if you have other medical conditions, like you have hypertension, diabetes, you smoke like a chimney, your cholesterol is 400, you could have coronary disease, which has nothing to do with long COVID. So just make sure, like Dr. Mel said, get back to your doctor and let them evaluate you and see next steps that need to be taken.
Yeah.
Okay, I have two questions from Tanya King out of Tacoma. Doctors, do you know what COVID does to the cells that causes long COVID?
Dr. Newby?
Well, that part we really don't know. What we do know is, again, I mentioned earlier that COVID is an inflammatory process. It starts because it's an inhaled virus, so it starts in the lungs, but it quickly can get transmitted to other organ systems. But why people develop that is still a mystery to a large degree. There's a lot of speculation, but no clear data that I have seen that convinces me that I know exactly what the cause is that makes it a long syndrome, or what drags those symptoms out. I tell people all the time, we don't know. That's why it's important to protect yourself.
And one of the things that we might not have brought out is that you mentioned the effect on the cells, the effect on organ systems. It also seems to, as I mentioned at the beginning, increase the risk for people developing chronic diseases like diabetes. I personally know several people who developed high blood pressure, who had normal to low blood pressure before they got COVID and had to go on blood pressure medicine after coming off the infection for several months. Increases chronic kidney disease. So there are a number of organ systems that it seems to affect and raise our risk for chronic disease as well.
Okay. And then the next question is for Sahtiya. With your long COVID symptoms, did you have brain fog, anxiety / depression, if you're comfortable answering that? And how do you combat those symptoms?
So I think actually, so there was there was a time in 2020, in March, April 2020, when I contracted, I was told I had bronchitis. I could not get anyone to give me a COVID test for love or money. And I feel like after that bout of sickness, I felt the brain fog symptoms that everyone's talking about. I mean, I also had my daughter home full time while I was trying to work full time. And so it was hard to say that, oh, this is brain fog. It just felt like exhaustion. And, it was very depressing and frustrating, and always, the luck of the draw. I started my position the week or two before, like the 3rd of March, and we all went home the 13th of March. So I was always very anxious about my work performance because, this is me showing up to the job for the first time, and I'm doing it under these really unique, challenging conditions where I have a 18-month-old. I think, yeah, she was 18 months when COVID started. And so I was always very anxious about my work performance. I was really frustrated and depressed. I think because I felt like I had no energy levels, and, come to find out, maybe that was all long COVID, because at the time we didn't know what that was. So I didn't know what to do with it other than to feel depressed about my own inability, I felt, to perform up to what I thought was appropriate.
Right.
Okay.
And I think we forget how difficult in those first few months were to get a COVID test, right?
Yeah.
Which is what you're talking about. I mean, now it's easy just to, get them in the mail. But back then you had to beg, cajole, find a doctor that would order it for you, all kinds of barriers. Yeah.
Yeah. Doctors, do you have any recommendations on how to combat the depression, anxiety, brain fog that some people experience with long COVID?
Well, I think that's somewhat of a more tougher question. I think the first thing is gaining assistance from your primary care. That may involve referrals to someone that counseling that may be helpful. I think this aspect of just COVID-19 itself was a depressing time I think for so many people, causing so much anxiety and problems, just figuring out, living in a different era than what we're used to. So that by itself was challenging enough. So I tell people all the time, go speak to your primary care physician, seek out the initial assistance there. And if they think it's appropriate to refer you to someone for counseling, I think that's helpful. There may be medications that may be helpful. I think the first step, though, is seeking that assistance.
Okay.
And I would say also too, excellent point. I always go back to the basics too, making sure you're getting enough sleep, making sure you're eating a nutritious diet, that you're moving every day, and that you're staying well hydrated, and that you're practicing your own forms of stress management, whether that be, meditation, yoga, playing the guitar, whatever it is, that you're doing it every day to manage your levels of stress, always returning to those basics, in addition to everything else that Dr. Newby mentioned.
Sahtiya, it sounds like the baby has something to say about your brain
Right.
fog.
Yes. I think the baby woke up the toddler, and now the toddler is so I apologize.
So
Yeah, one point I did want to make real quick to make sure people understand about COVID tests. A lot of the ones where the rapid tests, don't let a negative rapid test make you think that you don't have COVID. I know a lot of people are getting rapid tests. Number one, they test themselves too early. I think Dr. Mel may have mentioned that earlier in her discussion during the debunk phase about how long after you should get tested. Don't let it, if you have symptoms and you're really concerned, don't let that initial rapid test that may be negative sway you to think that you don't have COVID. I think if you're having symptoms and is concerned, make sure you go and get a PCR test or a more in-depth test to make sure that you don't have it, because that life you save might not just be your own, but your family and loved ones and the people, co-workers, whoever you're around. So I want you to get the rapid test, but just don't let a negative test in the face of symptoms sway you to think you do not have COVID.
Mm-hmm. Yeah, excellent point. Or in the face of a high risk exposure too. Like if you were around somebody who had COVID, and you just take a rapid test the next day, and you're like, oh yeah, I'm good. It's important to take a PCR test and take it 3 days after the exposure. Yeah.
Yeah.
Excellent points. Wow. Well, I can't believe that this time has just blown by. Thank you so much, Sahtiya, for your transparency and your sharing and sharing your experience with us. Thank you so much. Thank you, Dr. Newby, for all your words of wisdom. Really appreciate you. Of course, thanks to my wonderful co-producers. Welcome back, Lila. Thank you so much, Wayne. We've heard a lot tonight about long COVID. There's going to be more to come, and we're going to be here to make sure that everybody stays updated with whatever the latest is. As we're still moving through this as an ever evolving subject and pandemic that we're still in. Before I go, I want to make sure that you, my Be Health Empowered family, knows about this research study at Howard University that is all about COVID resilience. So all you have to do is fill out a 2-part survey. It's totally voluntary. But if you're able to do that, you'll be compensated up to $100 for the parts that you can, depending on the parts you complete. So if you're interested at all, research@gmail.com. So thank you so much for joining us. And we will be right back here next week. And remember, be wise, be well, and be health empowered.